Welcome to the Deep Dive. We're here to really get under the surface of complex topics, find out what's driving them, and today, well, we're looking at something that's quietly but profoundly reshaping the future of India. I want you to picture this for a second. A street in Mumbai. It's noisy, busy, you can almost smell the samosas frying. And there's this kid, maybe 10 years old, Arav, heading home. But he's got this packet of chips, a fizzy drink, and his steps are, well, they're a bit heavy. Not just the school bag, something more. And this isn't just Arav, this is playing out all across India. Delhi high-rises, Kerala villages, everywhere. It's speeding up, and that's the core of our deep dive today. India is really quite alarming childhood obesity crisis. So our mission, we want to unpack the numbers, obviously, but also the surprising reasons behind it all, and share the stories, the real-life impact. We need to understand what's happening, sure, but also why it matters so much for India, and really for all of us. And just to start us off, here's a number that, honestly, it just stopped me.
By 2030, projections suggest India could have over 27 million children and adolescents, that's 5 to 19 years old, living with obesity.
27 million.
Yeah. Think about that. It's huge.
Yeah.
It's bigger than the population of many entire countries, facing serious health issues before they're even adults. It's quite sobering.
It absolutely is. And, to really understand that 27 million figure, we need to be super clear on what obesity means in kids. It's way beyond just being a bit chubby or having some leftover baby fat.
Mm-hmm.
Clinically, it's when a child has too much body fat to the point where it's actually harming their health. We use BMI, body mass index, adjusted for age and growth, sure. But maybe think of it like this. It's like a backpack they can't take off, and it's just chronically overloaded.
Right.
A little extra is one thing, but when it's too full, the strain shows up everywhere, joints, the heart as it develops, overall well-being, that distinction is really, really key.
That's a powerful way to put it, the overloaded backpack. And okay, those India numbers are startling, but this isn't just an India problem, is it? How does this fit into the bigger global picture?
That's a crucial question, definitely. Globally, the alarms have been going off for a while now. In fact, UNICEF highlighted 2025 as this kind of historic turning point. For the first time ever, globally, more school-age kids are expected to be obese than underweight. Think about that shift.
Oh.
Yeah, 9.4% obese, just slightly more than the 9.2% underweight. And the WHO, back in 2022, estimated over 390 million kids were overweight or obese, with like 160 million of those actually classified as obese.
160 million.
It's huge. And this rate globally, it's been creeping up from about 5.4% back in 2000 to 5.7% by 2022.
Right.
And it's driven by, well, the usual suspects in some ways, rapid urbanization and the just relentless spread of processed foods.
Right, the easy availability.
Exactly. So while you have hotspots, say, the U.S. around 20%, Hungary maybe 15%, what's deeply concerning for India is that it's not just catching up. It's genuinely at risk of leading this trend. Commercial food systems are pushing these ultra-processed things hard, directly at kids.
And drilling down into the India-specific data, it gets even starker, doesn't it?
Yeah.
The National Family Health Survey figures you mentioned, they're pretty shocking. Adolescent girls, obesity rates up 125%. From 2.4 to 5.4%.
A huge jump.
And for boys, it's even more dramatic. A 288% increase. That's not a rise, that's an explosion.
It really is.
And when you think about South Asia having the world's biggest child population, even small percentage point increases mean millions.
Yeah.
Millions and millions of kids affected. It feels like a population-level crisis happening right now.
It absolutely is. And what makes India particularly complex is this thing we call the triple burden of malnutrition.
Right. Explain that a bit.
So on one side, you still have major issues with stunting, wasting, micronutrient deficiencies. Essentially, kids not getting enough of the right stuff. Undernutrition.
Okay.
But now, layered on top of that, you have this incredibly rapid rise in obesity, overnutrition. It's a health paradox. You find both in the same communities, sometimes even, believe it or not, in the same household.
That's hard to wrap your head around.
It is. And the projections, they're grim. Without major changes, India's obese youth population could genuinely outnumber any other nations by the early 2030s. We're talking potentially over 250 million kids under 14 who are vulnerable. It's like this massive storm cloud gathering over the very generation that's supposed to drive India's future.
Okay, so with stats like that, the big question becomes why? What are the main culprits here? What are the biggest shifts driving this, turning healthy kids, traditionally, into overweight ones?
Well, Top of the list, undeniably, has to be the shift in food culture. It's dramatic. Think about traditional Indian meals. The balanced plate dal, roti, sabzi. Fiber-rich, naturally low in hidden sugars. That was the backbone for generations.
Yeah, the staple.
Exactly. But
But it's
today,
like-
especially in cities, it's a completely different world. Families are grabbing ready-to-eat packets, ordering constantly via apps, ultra-processed foods deliberately engineered with loads of sugar, salt, unhealthy fats they're dominating.
It's not just that they're available, it's how they've sort of pushed out the traditional stuff.
Precisely. Take a popular namkeen, that savory fried snack everyone knows. A single serving can easily pack more calories than a whole home-cooked lunch of dal, roti, and sabzi.
Wow.
But here's the kicker. It leaves the child feeling less full. Hungrier even. Craving more.
So it's a double whammy. More calories, less satisfaction.
Exactly that. And it's marketed so aggressively, isn't it? Cartoons on boxes, celebrities endorsing sodas.
Yeah.
It's aimed right at kids.
And then you layer onto that the lifestyle changes.
Yeah.
Kids just aren't moving as much. I mean, I remember when streets would be full of kids playing gully cricket till it got dark. That was
Yeah.
just normal.
Yeah, that feels like a different era sometimes.
No, it's often video games inside, online classes, just hours and hours of screen time.
And the pandemic, of course, just threw gasoline on that fire.
Absolutely.
Lockdowns meant less outdoor play, obviously, even more screen time, and a lot of comfort eating. We saw studies showing Indian kids gained, on average, 2 to 3 kilos just during those restriction periods. That's significant weight gain.
Yeah, it really changed habits overnight.
And urbanization is a huge factor here, too. As cities grow, concrete replaces green spaces, fields disappear.
Fewer places to just run around.
Exactly. Plus, longer commutes to school often eat into recess time. And in big cities, Bengaluru, Chennai, think about the traffic, the pollution. It often just keeps kids indoors. Less activity overall.
So progress brings its own challenges, particularly for kids' health, it seems.
That's a double-edged sword, definitely.
And there are socioeconomic layers too, right? It
Mm.
affects different groups differently.
Oh, for sure. On one hand, sometimes more affluence means easier access to those calorie-dense foods. Think mall food courts.
Right.
But it's not just the wealthy. Even in rural areas, as incomes rise a bit, those cheap packaged snacks become much more available and, well, affordable.
And what about family structure?
That plays a role, too.
Hmm.
Nuclear families, both parents working long hours, they often rely on quick fixes. Instant noodles, ready-made meals. It's often a practical necessity because time is so short.
Understandable, but it contributes.
It does. And while, yes, genetics can play a part if parents are obese, a child's risk is 2 to 3 times higher. The really crucial thing is that lifestyle changes can make a massive difference. It's not predetermined.
That's empowering to know.
What's also quite interesting in the data is a gender difference. Boys in India seem to show steeper increases in obesity rates.
Really? Why might that be?
Well, it could be cultural norms. Perhaps boys are allowed more freedom for snacking, or maybe there's less focus on portion sizes for them compared to girls. It's complex, but the trend is there.
So let's bring it back to our fictional but typical 12-year-old Priya in Hyderabad. Her after-school time isn't playing outside. It's homework on a tablet, maybe a bag of chips while scrolling social media.
A very common scene.
And her mom, juggling 2 jobs, she goes for affordable, ready meals. It saves time, energy.
Makes sense from her perspective.
But over time, Priya's energy levels drop. Her clothes get tight. And then the doctor finds early signs of insulin resistance.
And her story is happening everywhere. You mentioned Punjab traditional parathas, maybe rich but wholesome, evolving into deep-fried, heavier versions.
Or Kerala, where banana chips, once an occasional treat, become a daily snack.
Exactly.
Yeah.
These small, seemingly minor shifts, day after day, they just accumulate into this enormous problem we're seeing.
So what is the fallout? What does this accumulation mean, not just for Priya and her family, but for India as a whole?
Well, the long-term impact is, honestly, it's devastating, and it goes way beyond just the physical weight. Health-wise, okay, you've got kids in India now facing type 2 diabetes. That used to be incredibly rare in young people. Now, spiking dramatically.
Really, type 2?
Yes. Plus, increased risks for heart disease later on, asthma, joint problems from the extra weight. The list goes on. But we often forget the mental and emotional side.
Right, the hidden toll.
Think about a child being constantly teased about baby fat that just won't go away. Bullying, low self-esteem, even depression. The psychological damage can be just as profound as the physical.
And looking longer term, what happens when these kids grow up?
The stats are sobering. An obese child is 5 times more likely to become an obese adult.
5 times.
5 times.
Mhm.
carrying those risks into adulthood hypertension, various cancers, and ultimately a shorter life expectancy. And think about India's healthcare system. Non-communicable diseases already take a massive toll, millions of lives every year.
That already strained.
Exactly. So this wave of childhood obesity could genuinely overwhelm hospitals and clinics. It's a huge potential strain on resources.
And beyond the human cost, there's the economic impact too, isn't there?
Absolutely. A significant economic drain. At the family level, you've got direct costs, medications, maybe therapy, parents taking time off work for appointments, kids missing school.
It adds up.
Definitely.
Mm.
And nationally, this crisis could shave something like 0.8% off India's GDP by the middle of the century.
0.8%. How?
Mainly through those escalating healthcare bills, but also reduced productivity from a workforce that's less healthy overall.
So it really makes you think, what does it mean for a whole generation, the future workforce, if they're potentially less able to work to their full capacity, especially for a country aiming for, superpower status economically?
Exactly. The World Bank already estimates that undernutrition and obesity combined rob countries of maybe 2–3% of GDP. For India, this childhood obesity wave is the new frontier, a massive challenge that could seriously undermine its economic ambitions if it's not tackled head-on and urgently.
Okay, so given the scale, the gravity of all this,
Yeah.
it leads naturally to solutions. What are the experts saying? What are the bold policy ideas or practical steps being pushed for? How can we turn this tide?
Well, the urgency is the main message from experts. Marie-Claude Desilets at UNICEF India really hammers this home. She points out, look, South Asia's obesity rates might not be the world's highest yet,
Right.
but because the child population is so enormous,
But sheer numbers.
any increase has this massive global impact. She says India has a unique opportunity to act now, especially with that complex triple burden we talked about.
So what's a key action point?
One of the absolute most critical interventions being called for is mandatory front-of-pack nutrition labeling, FOPNL.
Okay, like warning labels.
Exactly like that. Think clear, simple warnings on the front of food packages, high in sugar, high in salt, high in unhealthy fats. It lets people make quick, informed choices without needing a nutrition degree to read the tiny print on the back.
Makes sense.
And the Food Safety and Standards Authority of India, FSSAI, they're actually working on these regulations now. There was a Supreme Court nudge to get it finalized and implemented by late 2025.
So there's movement on that.
Yes, and it's not just theoretical. This stuff works.
Yeah, I could see how that would help someone like Priya's mom doing a quick shop after work. Clear labels could really empower her choices. What else? What other policies work?
Exactly. And we've seen FOPNL succeed elsewhere. Chile, Mexico, they saw junk food sales drop by 20, even 30% after implementing clear labels. In India, you have groups like NAP, Nutrition Advocacy and Public Interest, pushing hard for strong evidence-based labels, free from industry loopholes.
Good.
Beyond labels. Taxes on sugary drinks are another big one, proven effective. Places like the UK saw consumption drop 10–20%. Also, crucially, banning unhealthy food ads during kids' TV shows and curbing those big corporate sponsorships, soda giants sponsoring sporting events seen by millions of kids. It's about changing the environment.
Making the healthy choice the easier, more obvious choice.
Precisely.
And the good news, I suppose, is that India isn't totally starting from zero here. There are some government initiatives already in place, right? Showing some awareness.
That's true. The Fit India movement, launched back in 2019, is all about promoting daily exercise, school yoga, community runs, trying to get people moving more.
Okay.
FSSAI also has its Eat Right India campaign, using apps, certifying healthier eateries, trying to educate people on balanced diets, and even the big national nutrition mission, Poshan Abhiyan 2.0, it's traditionally focused on undernutrition, but now it's starting to look at obesity too. School programs talking about portion sizes, using less oil.
And wasn't there something from the Prime Minister recently?
Yes, in his 2024 Independence Day speech, Prime Minister Modi actually urged families to try and cut cooking oil use by 10%.
A small tweak, but potentially huge impact if widely adopted.
Exactly. A small change multiplied by millions of households makes a difference.
What about at the school or community level? Are things happening there?
Yes, and that's vital. We hear about campaigns, like one planned for 2025 in Jaipur schools, teaching kids directly to swap junk food for fruit through workshops, making it practical. Ayushman Bharat health centers are starting to offer free screenings to catch obesity early. Early detection is so important.
Absolutely.
And things like Poshan Pakwada, that Nutrition Fortnight drive, they now include talks specifically on adolescent obesity. It's learning from global successes, too, like Australia's Good for Kids, Good for Life program. They integrated health into schools, communities, media, and saw rates drop 5–10%. It takes a multi-pronged approach.
Okay, so lots of initiatives. But to really shift the needle long term, what else needs to happen? What are the bigger, maybe more fundamental changes needed?
I think we need to go further in empowering kids themselves. Really give them nutrition skills. Teach them how to read labels properly, understand ingredients. Maybe even, where possible, get them involved in growing food.
Connecting them back to where food comes from.
Exactly. That can change their whole relationship with food.
Mhm.
And systemically, supporting farmers to grow things like millets and fruits, shifting away from subsidies that might favor sugar production, for example.
More systemic changes.
Yes. Imagine more community gardens, even in urban slums. Kids harvesting their own salads. That's education becoming real action, improving diets right there. It's about building a culture of health from the roots up.
This really does feel like a critical juncture for India then. A chance to tackle this crisis, maybe even lead the way in Asia with things like FOPNL, inspire others.
It is a huge opportunity. And acting now isn't just, the right thing to do morally. It prevents a far, far costlier crisis later in human lives in economic terms.
And bringing it back to the individual level.
Yeah.
For Ara, for Priya, for those millions of kids,
Mm-hmm.
simple shifts can make a difference, can't they? A family walk after dinner, packing a homemade lunch instead of buying snacks. These small things, they add up.
They absolutely do. Obesity isn't some unavoidable destiny for these kids. It's a massive challenge, yes, but it's one we can tackle with collective effort and conscious choices.
So as we wrap up, maybe something to leave you, our listener, thinking about. As the sun sets over India tonight, healthier kids don't just mean healthier families tomorrow. They mean a stronger India, a more vibrant, more productive nation, better equipped for whatever the future holds. The clock is definitely ticking on this. But the power to change this trajectory, it really does rest in all our hands, communities, families, policymakers, individuals. So maybe ask yourself, what small conscious choice could you make today to be part of that change?